Good afternoon, everybody. Let's start again. And thanks for all for coming out today. And there's a number of people standing behind me that I appreciate being here today because they represent the tremendous collaboration that we're seeing in this community right now. And it's especially meaningful when it comes to making sure that people have health care. That's what this is about today. So I'm going to mention some names. If I miss anybody, I apologize in advance. But first and foremost, my good friend and leader in this community, Mayor Frank Jackson. Thank you for being here. I saw County Councilman Anthony Hairston here, and County Councilman Dale Miller's here. We have, I believe, Craig Richmond from Metro Health, Kristen Morris from the Cleveland Clinic, Dr. Lally McDavid from University Hospitals, Sarah Hackenbrock from CHAP, David Merriman, who you met a few minutes ago, from Job and Family Services and the Benefits Eligibility Team at the county. Cuyahoga County Public Library is represented by Tracy Strobel, and the Cleveland Public Library is represented by Felton Thomas. Also participating in this collaboration is the Adams Board, United Way. I believe Jason Daniels is here from United Way. The Free Clinic is part of the collaboration. The County Board of Health is participating. The Care Alliance, the Neighborhood Family Practice Group, NEON. The list is very comprehensive, and of course, we're thrilled to be here before so many of our esteemed members of the clergy and the organizations in the community that you represent as well. We're here to rally together today in support of expanded Medicaid. Over the past year, this community came together to support Medicaid expansion, and we were successful. It has happened, and today there are thousands and thousands more people getting health care that they desperately need than have been covered in the past. Many of you in this room led the way, and you deserve great thanks for that. Our focus has been clear: to support this exceptional program and assist the men and women that we serve to get health insurance. Through your efforts, Cuyahoga Job and Family Services received over 100,000 applications for expanded Medicaid, and we helped enroll over 90,000 of those persons here in Cuyahoga County. That is a big deal. 90,000 people who are working but generally only earn $10,000, $15,000 in that range. Not enough to be able to pay for private health insurance. That means there are 90,000 individuals and families who now have the opportunity to receive the medical care they need in our community. But our work is not done, not by a long shot. Under the law, those 90,000 Medicaid recipients must now reapply, updating their information. It's not that hard to do, but it has to be done. If they don't, they will lose their Medicaid benefits. Some will lose their benefits as early as the end of this month. The state of Ohio has sent thousands of county residents a letter informing them that they've lost or will lose their eligibility for Medicaid. And over the next several months, more residents will receive these letters. More residents are at risk of losing their health care. We need your help to share 3 important messages about expanded Medicaid eligibility. First, there is still time to act for people that have received a letter from the state, even if it says they lose their benefits in the next couple of weeks. But they need to get their information into the system soon. Second, for those that have not yet received a letter but are enrolled in expanded Medicaid, they need to submit their reapplication materials as soon as they get them. And third, submitting the reapplication materials through the website, www.benefits.ohio.gov. I'm going to repeat that, benefits.ohio.gov. That's the best way to send in the information that's needed. If people need help with these applications, we're here to help them. But using the online app will speed the process along. And it'll also help us look for other benefits that residents may be eligible for at the same time. Before we go further, I want to be clear. We're talking about expanded Medicaid. We're not talking about the standard Medicaid that supports aged, blind, disabled, or children. That program is not affected by the deadlines we're talking about today. You still have to keep your information updated. They have rolling eligibility for those programs. That's not what we're talking about today. Today we're talking about the expanded coverage that came through the Affordable Care Act that thousands of people signed up for during the last year. Here's what we need recipients of expanded Medicaid to do. We need them to submit their applications as soon as possible, preferably through the online renewal process at benefits.ohio.gov. They should open or use their existing account, if they have one, and select the Renew My Benefits feature. This is the fastest way to submit the information. benefits.ohio.gov. Select the Renew My Benefits feature. Even if residents submitted through the federal marketplace, through the exchanges, they should open an account to reapply at benefits.ohio.gov. Come to one of the Cuyahoga Job and Family Services neighborhood service centers at Quincy Place, Southgate, West Shore, Old Brooklyn, and the Virgil Brown Building. Speak with our staff. We can help. We also have self-scanning stations and open computers for this purpose that we've designated. To help us in this effort, we have the collaboration of both the Cuyahoga County and Cleveland Public Library systems. Thank you for your support there. They'll be making some of their computers available for patrons to submit their online applications. So when you're talking to your parishioners this Sunday, you can suggest that they go to the Cleveland or Cuyahoga Library and talk to someone about getting on the computer to submit their reapplication. These computers will be available for a longer time than normally allowed. Felton Thomas and Tracy Stobel, who are both here today, thanks for these resources and for your consideration. Also, we'll be working with 211, with United Way, and area providers to assist people with applications. Anyone in the greater Cleveland area can call 211 and find the location of a JFS center, a library, or other provider that can assist with this work. 211, a great place to call. It's easy, just remember 211. Just tell your parishioners, tell the people you come in contact with, they've got to reapply, call 211, they'll get the help they need. 211 United Way is lined up to help right now. Lastly, we need everyone working with expanded Medicaid clients. Many of you have organizations that you're involved with that work with clients that have Medicaid. We need you to tell them not to wait any longer to get their reapplication materials in. Many of you have heard me talk about the importance of building partnerships between the community groups that you represent, between religious organizations that you all participate in and represent, and nonprofit organizations and the county. We talked about this during the campaign. We talked about this for months and months. These kind of partnerships are critical to the success of our community moving forward. You're the ones who best know the communities. You're the ones with that hear the regular concerns of your parishioners, your constituents, especially those who may be most in need. You know who needs the help. And I need your help today. I need your partnership today. We need to get the word out to get people to reapply for Medicaid. We need to help people keep their critically important Medicaid benefits. We at the county will be doing our part too. We'll be going out into the community to let people know that they have to reapply and that we can help them. We'll process all applications, both renewals and new ones. We'll do that as quickly as possible. I think we've shown in a short time that the county can move quickly. In fact, we just heard about this problem last week, at the end of last week, and you see all this group that's come together so quickly. Government and community organizations and community groups and the clergy, we're here together quickly to help people who need it. The online and JFS office systems recognize the date the application was submitted, the date it was submitted. So getting materials in by the end of the month is critical. We'll have additional staff here at the county in our waiting rooms to answer walk-in questions. We'll open computer labs on the east and west sides at the Quincy Place and Old Brooklyn JFS Neighborhood Service Centers for clients to process their applications. And we'll mail clients that received the letter a self-addressed, postage-paid envelope with a worksheet on completing the application. Together, we can help people keep their Medicaid benefits that we all in this room worked so hard to help them get in the first place. Thank you very much. Jason Daniels from 211 is going to speak to you. See, I knew that.
We have a great leader at the county, so thank you for your work that you're doing, and thank you all for being here. My name is Jason Daniels, Executive Vice President for United Way of Greater Cleveland. The most important thing you need to know as you begin the process to renew your Medicaid benefits is United Way 211 is here to help. It's a 24-hour, 7-day-a-week hotline that anyone can call at any time, and it's basically set up so that people know where to go to get help. United Way 211 will assist callers with finding area providers to help with completing the applications, as well as help you with the online application. 211 is there to help with Medicaid renewal 24 hours a day, 7 days a week, as well as your referral services to all social service agencies in the community. And as a reminder, we're fortunate to have a 211 in our community. There are still communities throughout Ohio that do not have this valuable resource. Thank you to County Executive Budish for your support. And I'm now going to turn this over to whoever is next. So thank you for the time.
Thank you. Okay, I think no one is next. So if there are any questions, either I or one of these many experts behind me will try to answer it. If you have any questions. Yes, sir.
How many are in danger of losing their Medicaid benefits?
How many are in danger of losing? I believe that it's, we don't know the exact number right now. We've asked for those, we've asked for the information from the state, and we're waiting to get that. But our best guess is that it's going to be up to 90,000 people as the maximum in Cuyahoga County, which is a lot of people, over the next 5 or 6 months. This is going to be going forward over months. Hopefully, we'll be able to keep most of those people on Medicaid. Yes, sir.
Mr. Executive, I had a member who tried to submit their application at Quincy Place. They were told that it needed to go downtown first, and that it had to go through a scanner first before it went to Quincy Place. So there's some misconceptions in where the information is supposed to go. And they said that they did not get a return envelope in their package, which would have been important because they could have just mailed it right back in. But they felt important to go to the office.
I'll turn it over to David Merriman for that.
Well, first, thank you very much for following up with us. We want to have a no wrong door approach, and so I will follow up with you to get the information that I can, and we'll address this case. And I want you to be assured of that. Secondly, the state did not send out returned envelopes. These reapplication materials, they came from the state, and the state sent about a 14-page packet, but they didn't include a return envelope and postage paid. So as we get a better sense of the numbers and we see who needs an envelope, we're going to take care of that in Cuyahoga County.
Thank you.
What's the time limit on the
I believe that what'll happen is that this will happen month by month. So each month there'll be 9, 10, 15,000 Cuyahoga County residents that get a letter saying that they're basically losing their Medicaid benefits, and if they don't get their reapplication in by the end of that month, they've lost them. So as soon as somebody gets that letter, they need to act quickly. And for those who are just are new on everybody who got the expanded Medicaid is going to be covered by this because it's all within the year. They should all be looking and getting their reapplications in as soon as they can. They don't have to wait for the letter to come in from the state of Ohio. Yes, sir.
With technology being the way that it is it possible they can scan it through or fax it through?
It's a great point. Yes, it is possible. The best application, I'm sorry, the question was, with technology being what it is it possible for clients to scan their applications in? And the answer is yes. I would still point us back to the best solution is to apply through www.benefitsohio.gov. And the reason for that is that brings the information directly from the individual into the system. And that is seamless. It also helps us look and see if that resident has eligibility for other services. And so that's why it's so important for us to try to open as many of those accounts as we can.
And they can fax it as well?
They can fax it. I'll follow up with you and I'll get a fax number.
Any other questions? Well, I'm sure over the next few weeks and months you'll have more questions. Please call our office, call David Merriman at the County Department of Job and Family Services, or you can call 211, or you can call United Way. You can go to the library, Cleveland or Cuyahoga. They'll be helping you. There's lots of avenues to get help, but the most important thing is people don't know about this. People don't know. That's where you come in. That's where we need your help. You've got to get the word out to people in your churches, in your community centers, in your organizations. Let people know they've got to renew the Medicaid that was expanded last year.
We have another question.
Oh, okay, last question, sorry.
In addition to the libraries being open, those of us that have computer labs, can we offer that to support this effort also?
Absolutely, and thank you for that. That's a great offer. It's where not only do you have computers, because computers are available in a variety of locations, but you probably have a person there to help them. And that's what's really important. If we simply make computers available, many people will have the knowledge of how to use them. But it is that personal connection that's so important. So thank you for that offer. And as you identify that you have a computer lab, if you'll let us know that, we'll make sure 211 knows it, and so we can spread the word. Yeah, so there was a question about, are there resources for limited English proficiency or non-English speaking individuals? And the answer to that is yes as well. If you will contact JFS, we have a contract with Us Together, and Us Together will assist us. We also have some great resources in this community, folks like Max Rodas at Nueva Luz, who have a health ministry. So we have the resources in this community, and they are at the community level, they're also in our organization. So if you have clients that have limited English proficiency or just want to sit down with somebody and walk through these applications, please reach out to us, and we will do what we have to do in this situation.
Well, I lied. I said that was the last question. When Mr. Bibb raises his hand, I'll take that as the last question.
Fell between the cracks, so I'll get in touch with the director, have him get in touch with you, and we can hook up East Cleveland, because we know we got a lot.
Great. Okay. All right. Well, again, I see Councilwoman Conwell, who I did not see earlier. I'm sorry. Thank you for being here.
My council person, Yvonne Conwell, asked the question, what happens if an application falls through the cracks? We want that application getting into us. If somebody has submitted an application and they haven't heard back, they need to call us and let us know. Once we get the application, we do date stamp it, and we do have the ability to look back for a period of time, and it's several months. But we don't want to rely on that. The time is now. The time is now. We need applications in now so that we don't have to go back and try to process and backdate. That gets messy, and if there is a problem, it's better to fix it now and not wait until there's a look back or some other situation.
But do you have a phone number in place? Because I know a lot of people who do try to call their case manager or their contact person, they cannot get through. So how do we help the ones, and they say, I don't call, they won't return my phone call. Like the gentleman said, you know, no, you can't do it here, our scanner is down. I've been at certain places, the scanners are down. What are your backup plans? How can you do this? Because we already know that you can't get through your case manager and they don't return the phone calls. What number is in place for this?
We do have the 9877,000 number, but you've got a very valid point. Workers have full caseloads with this project. I think, as Armin referenced, over 100,000 applications came through us last year, and we've responded to them. And we are very sensitive to the fact that some people can't get through to their caseworkers. We are putting in a new phone system this year that will enable us to not have phones get not answered, or not to have busy signals. And so we're aware that we have some areas of improvement, and we are dedicating resources because it is unacceptable. It's unacceptable if the phone is busy, and we're going to do what we have to.
Voicemail, they don't return their voicemail.
I appreciate that, and we are committed to it. We run a full voicemail report, and we address those cases. We have our eligibility staff that are here today, and I'm going to ask them to raise their hand. They're in the corner. I have Leisha Coggins, I have Eugene Walton, I have Anthony Forbes, Jackie Ward. There are others back there. We have the administrative staff from each of our neighborhood service centers, and so if you have specific concerns, please talk to me after. I want to know about them, and we're going to work on this.
Thank you.
Yeah, some of the points that you made are bigger than just this issue, obviously, and I've only been in there 6 weeks, so give me a little time, but we're going to try to fix all those issues. Anybody else? Okay, well, once again, thank you all very much. I really appreciate your help on this collaborative effort, and this is very important. Thank you.